Welcome, everyone. Welcome to the Johns Hopkins Government and Community Affairs Showcase Series for a conversation. As everyone is joining our conversation, we invite you to get comfortable, buckle your seatbelt, and get prepared to learn more about how we can all support disability health research. We have an exciting speaker that's joined us today. I am Delegate Shanika Henson. I serve on the Appropriations Committee and the Health and Social Services Subcommittee here in the Maryland House of Delegates. I'm so thankful to be here with Johns Hopkins Government and Community Affairs to be a part of their Showcase series. If you ever tuned into the Showcase series before, then you know that this is going to be an action-packed discussion full of lots of great information. Today, we have as our guest Dr. Bonnielin Swenor from the Disability Health Research Center here at Johns Hopkins University. Dr. Swenor's work has been to shift the paradigm from living with a disability to thriving with a disability and getting the maximum health, equity, and participation for people with disabilities. That's been her passion, and that's why she's joining us here today. Before we get into the discussion, I want to go over some logistics. This webinar will be recorded and it will be posted to the GCA and Hopkins at Home websites with captions included. Additionally, the question and answer function will be enabled during this webinar. Please feel free to type your questions there and we'll do our best to respond to as many questions as we can with the time that we have available for this important topic. With that, I'll ask Dr. Swenor to tell us more about her work with the Disability Health Research Center. Dr. Swenor?
Thank you so much, Delegate Henson. I am so grateful to be here with you all today to talk about the Johns Hopkins Disability Health Research Center and our exciting work to advance health equity for people with all types of disabilities. So I want to start this conversation by first asking you all to think about disability. What does disability mean to you? How do you define that word? And I know if I ask everyone in this virtual space for a definition of disability, I'll get just as many different responses as there are people in this audience. When I talk about disability, I frame it across three main concepts. The first is an understanding that by design, disability is defined very broadly. To capture this broadness, the Centers for Disease Control and Prevention, the CDC, defines disability as any condition of the body or mind that makes it more difficult for the person to do certain activities and interact with the world around them. The Americans with Disabilities Act, the ADA, which is arguably one of the most important laws for the disability community, defines disability as a physical or mental impairment that substantially limits one or more major life activities, a record or history of such an impairment, or being regarded as having a disability. I share these two commonly used and very broad definitions of disability to show how a wide range of people can fall under the umbrella of disability. This includes people with mobility, sensory, cognitive, and learning disabilities. It can also include people with mental health and chronic conditions. This means disability can include people with diabetes, with depression, anxiety, people with dementia. It's important to remember that disability can be temporary, can be permanent, can be visible, and it can be invisible. The second point to remember is that disability is very common. People with disabilities are part of all of our communities. More than 1 in 4 American adults has a disability. On this slide shows recently updated disability prevalence estimates just published from our team. And it indicates that about 28% of Americans living in the community, American adults, report having a disability. When this data is age adjusted, the estimate goes to about 27%. And I'll note that it's important to know this is actually an underestimate, and we know that. The data used to generate this estimate comes from data sources that don't include people living in nursing homes, for example. This data really intends to show how common disability really is. The third concept is an understanding that disability is an evolving concept. Healthcare, and in most research settings, disability is defined under what's called a medical model, where disability is conceptualized as the presence of an impairment in functioning or body structure. But for many people with disabilities, disability is different. Disability is viewed as a social construct. The social model of disability considers disability identity, and it's the intersection of a person with their environment. This shift from the medical to the social model has been in part driven by what's called the disability justice movement. Disability justice recognizes that people with disabilities experience inequities across society and calls for these inequities to be addressed. In essence, it's about no longer viewing disability as the opposite of health or solely as something to prevent, to treat, or to cure. Disability justice embraces the idea that people with disabilities are valuable contributors to all aspects of our society. But although disability is so very common, health disparities remain largely unaddressed for this population. Most public health and medical research efforts are primarily focused on the prevention and treatment of disabilities. And while these efforts will always be present, this focus leaves inequities that the disability community faces unaddressed. To move towards equity for people with disabilities, we urgently need research aimed at maximizing the health and inclusion of people with disabilities. And right now, there's a lot of discussion around these topics of equity for so many communities, and there's good traction for change. This dialogue has opened up conversations around the difference between equality, which is where everyone gets the same thing, and equity, where people get what works best for them. This is an important concept, an important difference for the disability community. And disability justice recognizes that for people with disabilities, quality is not enough. Equity is our goal. And there's much evidence of deep inequities that people with disabilities face. So on this slide are bar graphs showing additional data from the Disability Center, indicating that as compared to people without disabilities, a higher percentage of adults with disabilities in the United States have less than a high school education, have a household income of less than $25,000 per year, and a higher percentage are unemployed. But the experience of disability is not the same for everybody. And I'm not just talking about differences by different types or categories of disabilities, which are certainly important to consider. I'm talking about the need to recognize that people with disabilities from other intersecting minority groups, such as people from the Black and Hispanic communities, face even deeper inequities. So on this slide, I'm showing additional data from our work indicating that the disparities in education, in income, and employment are greater, are deeper for people with disabilities who are also from racial and minority, or from minority racial and ethnic groups, such as from the Hispanic and Black communities. So I want to bring this back home to Maryland. In Maryland, approximately 22%, or 1 in 5 Maryland adults, has a disability. That's about 1 million people. We see similar inequities for the disability community in Maryland that we see across the US. For example, which I'm showing on this slide in the bar graph, is as compared to adults in the state of Maryland who do not have a disability, Marylanders with disabilities have a higher percentage who are obese, who smoke, have diabetes, and have heart disease. In summary, the data really are clear. People with disabilities face persistent health inequities. So the question is how do we change this? What do we do? How do we achieve equity for people with disabilities? This is the central question for all of my work. And my work is motivated by my personal experience. On this slide, I'm showing a bank of escalator steps. And these steps and this photograph is taken from a metro stop in Washington, D.C. I show this because this is the exact location where my own journey with disability began. Over 15 years ago, I was on my way to work. I was admittedly running late that day, and I was walking up those steps. About halfway up, I had a very sudden and drastic change in my vision, and I was later diagnosed with a degenerative retinal disease, and I've continued to lose my vision since that time. That day on those steps, there's no denying that my life changed completely. When the diagnosis and the idea of continued vision loss sank in, I was admittedly deeply depressed, and I even thought that my life was no longer worth living at certain points. A week before that sudden onset of vision loss, I had just mailed out applications to graduate school programs. I had gotten married 6 months prior. And at that time, I thought there was no way I could live the life that I had hoped and dreamed to. I thought there was no way I could be a researcher. I didn't know anyone else like me. I didn't know anyone else with a disability, with vision loss, let alone a researcher with a disability. Miles of life have happened between that day and now. And when I reflect on why I felt the way I did about having a disability, about losing my vision, I realized that those feelings were reflections of how society views disability. Society had taught me that disability was the end, not a beginning. At that time, I thought my life had less value because I was losing my vision. But now I know better. That view, that stigma, the notion that people with disabilities are lesser could not be more wrong. I recognize that not everyone is grateful for their disability, and it's important to understand that many people view their disability as part of who they are, part of their identity, not something to overcome. And it's time that society reflects those views and recognizes the lives of people with disabilities matter. We are not lesser. In 2019, I founded the Johns Hopkins Disability Health Research Center, aiming to bring people together to address the inequities that people with disabilities face. I plainly define our work as aiming to change the paradigm from living with a disability to thriving with a disability. My goal is to use data to change how people with disabilities are included throughout society. The center has 4 strategic goals. The first is all about data. We're focused on filling disability data gaps. In order to drive change, we need data. We need data to identify all the disability disparities, even beyond what I discussed, to track change, and to advocate for better policies for the disability community. We need this data outside of what is commonly thought of as quote unquote disability issues. Our work is built on the notion that all issues are disability issues. As a result, the center is working to improve where and when disability data is collected. The second goal is to address barriers to health equity. Even with disability data gaps, there are known health inequities for the disability community. People with disabilities face inequities in food access, in transportation, education, employment, and healthcare outcomes. We're disproportionately impacted by climate change, experience bias in certain uses of artificial intelligence, but we're often not part of these conversations. The center is working to holistically address these inequities, and we're focusing on creating strategies that change entire ecosystems, not just focused on one community at one time. The third goal is training the next generation of disability researchers. In building the center, I've realized we have a shortage of researchers who understand disability from this contemporary framework of disability justice. We're working to change that through collaborations, research projects, and a goal of establishing a disability health education curriculum. We also recognize that disability is a critical dimension of diversity. The center is working to increase the inclusion of people with disabilities in higher education, across STEM, in medicine, and including people with disabilities as faculty and staff at universities. The last goal is one of the most important, which is partnering with the disability community. Just as we have learned from other groups, research about the disability community can no longer be conducted without the disability community. We must abandon the historical approach of laying our hands on the disability community and instead learn from people with disabilities. The disability community must guide us on what is important to study and where we should allocate our resources. This work should be accomplished through true partnerships with people with disabilities and by including people with disabilities as our collaborators, as researchers, and as leaders. The center focuses on 3 overlapping areas to accomplish these goals: research, education, and policy. And all of this work is built on our central value of inclusion, including people with disabilities in all phases of our work, and focusing on intersectionality in that approach. So I want to share an example of the center's work. And this is an example of the work that we conducted during the pandemic that focused on filling data gaps. When we started this project, the disability community was experiencing clear inequities in early stages of the COVID-19 vaccine rollout. This included variation in how people with disabilities were or were not being prioritized for COVID-19 vaccine. There was an amazing undergraduate student working in the center, Sabrina Epstein, who's now graduated from Hopkins. And she had noted that her grandfather was living in one state, could have been eligible for the vaccine had he lived in another. We launched this dashboard to assemble data that was available to us in the moment in an effort to highlight disability inequities across states in the vaccine rollout in an effort to drive change. I want to first and upfront thank the multiple partners who made this work possible. We jumped into this project really quickly. It was a very fast-paced project, and it required a very dedicated team. This included many staff and students from the Disability Health Research Center, partnership with the Center for Dignity and Healthcare for People with Disabilities, led by Dr. Kara Ayers, our continued partnership with colleagues at WebAIM, and our collaborators at the Johns Hopkins Biostatistics Center. And all of this was possible because of funding from the American Association of People with Disabilities. So our dashboard collected data from health departments of all 50 states, the District of Columbia, and 5 US territories. We updated this information weekly, and we prioritized the accessibility of the information on our dashboard so that the community, the people with disabilities themselves, could access the content. We collected data on vaccine prioritization across 5 groups related to the disability community: people living in long-term care and nursing home facilities, people living in other types of congregate care settings, people with chronic conditions, caregivers, and a group we called an additional or other group, which is a mix of how different states were prioritizing people with disabilities in various ways, including people receiving direct support care in the community, people with intellectual and developmental disabilities, and recipients of certain Medicaid programs. So we collected this data. We showed it in table formats and visual formats, as I'm showing here, and maps and bar graphs. And these data indicated which states were administering shots in arms for each group that we were tracking and when people would be called up to become available. We tracked this data over time. And then we subsequently launched a second dashboard based on feedback from the community. We heard from lots of people with disabilities that the websites providing information on COVID-19 vaccine from states was actually not accessible, and neither were the portals to register for vaccine. So we began tracking the accessibility of those websites by working with our partner at WebAIM, who has an algorithm to score website accessibility, and we took a similar approach. We showed this data in tables, in graphs, in maps to provide flexibility of how people could interact with the content. We made sure our content on our dashboard was accessible. When we embarked on this project, I was not really sure what to expect, I admit, but the impact ended up being much bigger than I could have ever imagined. We launched our initial dashboard on February 8th, 2021. It ran through April 21st, and our accessibility dashboard ended on May 19th. It ran a little bit longer. But within 24 hours, actually less than 24 hours of us launching that dashboard, the National Council on Disability, which advises President Biden and Congress and other federal agencies on disability policy, cited our dashboard in a petition to the National Governors Association, asking for reconsideration of how people with disabilities were being prioritized for vaccine across states. Our dashboard has been cited by numerous local, state, and national advocacy groups, and at its peak, we had over 2,000 dashboard visits per day. I was also surprised, admittedly, that we had a lot of media attention. There was a lot of more attention on this topic, and I'm grateful for it to highlight these issues. We were featured in an article in Time magazine and were included in many wonderful articles, and I'm grateful for that, for all the journalists who contributed in elevating these issues and helped push this change forward. And gratefully, Dr. Kara Ayers and I spoke at the Biden-Harris COVID-19 Health Equity Task Force. Dr. Kara Ayers presented this work, and then I made a comment at the end of this call. So I share this example of our COVID-19 dashboard because it really exemplifies the work of the center in advancing health equity for this population, and it's using what I call a disability data justice framework. This approach recognizes that disability data is the first step in making broader societal change for people with disabilities. This process often begins with building data infrastructure like we did for the COVID-19 dashboard. The goal is to advance equity for the disability community. We often need to create systems to collect disability data because they're not already there. That includes collecting disability data in healthcare settings, in education, employment, food access, transportation, and on and on. There's a lot of work to do. But the goal is bigger than just research output. The goal is to create a system that removes the burden of justice from people with disabilities. So what I mean by that is the current paradigm is that people with disabilities must go to great lengths to elevate inequities. The Americans with Disabilities Act, the ADA, currently requires individuals to file individual complaints and to make change themselves. We're working to create data systems that remove the burden from individuals and establish a structure of accountability to drive broader change. And the goal is not just to create change for one person or for one area. Instead, we're aiming to create ecosystem change. We're interested in building disability data systems that change the way we care for patients across healthcare, change the way we educate students from kindergarten through higher ed, change the way we design our communities, change the way we respond and plan for public health emergencies. The goal is to create a data-driven approach to maximizing health, equity, and inclusion for people with disabilities. But this work does not occur without people. Until now, universities and higher education have not engaged enough in advancing disability equity. And as someone who is part of a university, I feel that this has to be part of the goal of the center. It's undeniable that universities are epicenters of societal change. To me, this is an important and untapped opportunity for this work of disability justice. Universities are where we educate the next generation about disability, train future disability researchers, and teach the value of including people with disabilities in our communities. Because of this, the center is also focused on using similar data-driven approaches to support improved disability inclusion and accessibility across higher education. Most recently, we launched the University Disability Inclusion and Accessibility Dashboard. We recognize there's not been a way to compare and contrast disability inclusion policies and accessibility practices across universities. This information is needed to determine what's working and what's not, to find exemplar institutions and to track improvements in these indicators. We've developed a novel scoring system to do just that. And the goal here is to improve accessibility and disability inclusion at universities. You can learn more about this project and see the scores of the 50 schools included by going to disabilityhealth.jhu.edu/inclusion dashboard. So the Disability Health Research Center is continuing to push to advance equity for the disability community. We're moving forward with many other projects, including a suite of additional disability dashboards that are focused on transportation, food access, and other areas to come. We're working to develop a community-level disability equity index and continuing on our work to create data-driven approaches to removing barriers to higher education for people with disabilities. This work is a true team effort. I am grateful to all of the dedicated staff, faculty, students, and the people who are supporting the center. It's only because of all of these individuals that this work is possible. And I want to end by just underscoring with what I hope is the main concept that you take away from this conversation. Health equity cannot be achieved without the disability community. We need better data. We need a focus on accessibility. We need to ensure the disability community is included. You can learn more about the Johns Hopkins Disability Health Research Center by going to disabilityhealth.jhu.edu or follow us on Twitter at JHU Disability. We also have a podcast if you're interested called Included, and you can follow us at Included Pod. Thank you so much. Back to you, Delegate Hinson.
You, Dr. Swenor, what a powerful presentation on disability health and the research that's being done at Johns Hopkins University to support advancing the goals that were laid out in the presentation. Thank you for sharing with everyone that's viewing in the viewing audience your personal experience and how it's informed your passion and your advocacy. It's wonderful to learn. I think you are a shining representation of how the disability community can certainly thrive with disability and not be hindered or held back. So that was so wonderful to hear. I'm sure you've inspired a lot of people that are tuning in today. To our programming note, this information will be recorded and it will be able to be shared. So if you know anyone who could benefit from hearing this discussion, who is right in line with Dr. Swenor and all the different concepts that were discussed, please share this discussion with anyone that you know that could use extra support, anyone that you know that's looking to learn more and inform themselves on how they too can be an advocate for the disability community. So Dr. Swenor, I'd like to do a little question and answer. Is that okay?
Yes, that'd be great.
Wonderful. So I know that we have some questions that will be rolling in. Again, the question and answer feature is available on this web series, so you can use the Q&A and drop in to give us your question. And we have some that have already come in. One of the questions that we have is trying to understand the broader impact that your work is having in the state of Maryland. I know that you were able to highlight the COVID dashboard for us and showing how vaccine distribution, how it was impacting the disability community. Are there any other examples of how the work is impacting the state?
Yeah, thank you so much for this question. I'll say up front, our goal is to have as much impact on Maryland as possible. That matters to me personally as a Maryland resident, as a person with a disability myself living in Maryland. I have direct impact on that. I want to just talk for a minute a little bit specifically about the dashboard in Maryland. And when we launched our COVID-19 dashboard for people with disabilities, we had a fantastic response from the state of Maryland. So the dashboard, the second dashboard that we launched on accessibility, when we first released it, Maryland's accessibility was lower at the bottom. But within a week, actually within days, Maryland responded. They took that very seriously. And with our next update, a week later, they were at the top. They were at the top 10%. They had improved their website accessibility. We had a strong response from the community within the state. And I think it just showed the important valuing of the disability community in this moment, and it was really great to see that the impact this had within the state right at a critical moment.
Thank you for the work that you're doing there. Can we stick with the topic of COVID-19 and take another viewer question? Dr. Swenor, the viewer is asking, how has COVID and the lockdowns that came with COVID affected your ability to collect data and the quality of data? And also, how are you adapting to that challenge?
Yeah, that's a great question. Um, the pandemic certainly has caused all researchers to reimagine how we are collecting data, us included. Um, but in lots of ways, I think it's an opportunity to include more people in the research process and to consider ways to make this more accessible. We still, I think, as researchers, have work to do on those fronts, but um, historically, when you're collecting data from people, it often required having people come in and have some interaction in person, and we're letting go of that as being a requirement. And so you can imagine for lots of people with disabilities, that opens the doors for participation in ways that wasn't possible before. So it's been a learning process, in short, right? We're learning a lot, but it's been an opportunity to get accessibility and disability inclusion in research at the forefront of this conversation. I will say, in addition to that, there's been important conversations as this all is happening to just include disability questions as people are revamping their approach to research, and that's critical. So many aspects of research aren't thinking about disability, and the thing I advocate for is whenever you are collecting data on gender identity and race and age, you should be collecting disability information as well. And it's been a great opportunity to do that. Great question.
Sounds great. I want to kind of stick with the theme of our data collection and the things that we're doing to pivot and adapt to the different challenges that we're facing, and take on a viewer question that's asking about how the state of Maryland is adapting to address some of these issues. I want to open the door on that discussion by talking about our own experience that we had here in the legislative session. We had to pivot to a session that was almost all virtual. A lot of the participation from the public came in virtually. So making sure that our systems and our platforms could adapt to be accessible was something that I know Speaker Adrian Jones and leadership in the Senate President Ferguson, we were all meeting that rising challenge as we were in session. The advent of new and diverse technology resources means that, to Dr. Swenor's point, we have to have an eye for equity and disability justice when we're making sure that we're designing new programs to meet our rising challenges. I know that one of the things that we were happy to pass this last session was incorporating the opportunities for telehealth into our state's insurance system to make sure that persons that didn't have the opportunity to go in for appointments were still able to be treated and seen by their physicians. And we understand that for some people who have some of those intersectional challenges that Dr. Swenor brought up in her presentation, of having access to being able to get for transportation, access to the resources that you need to be able to participate in a market where you go to see your doctor, we were really proud that that work that we supported was tackling some of those intersectional challenges. So we're really thankful for that question. Dr. Swenor, did you have anything to add to how the state of Maryland is already or can in the future do a better job at having the accessibility gap?
Yeah, such an important question. I just want to add a comment about Maryland and its uniqueness in this space of disability, which I admit makes this work better doing it here. I want the audience to understand just how unique Maryland is when it comes to disability inclusion and disability policy. Maryland is the nation's first state to elevate the Secretary of the Department of Disabilities to a cabinet level position in the governor's office, right? I think about that often in this work and what that means and the message that that sends to the disability community. It's an important one, right? And I can see that and feel that impact. Another very unique feature of Maryland in this space is a really holistic and cross-sector approach to disability policy. it is very clear to me that there is a understanding that all issues impact the disability community. And that's what disability justice is all about. This is exemplified by an impressive depth of disability data that is already collected in the state of Maryland and a forward-thinking approach to how the state's leveraging this data. So every 4 years, Maryland puts out what's called the State Disability Plan. It serves as a roadmap for change within the state. It includes recommendations, outlines for funding and service needs for people with disabilities. It identifies measures to track and really helps to create a coordinated delivery system for people with disabilities across the state. So in essence, this is the underlying data structure that I've looked to and learned from, and I've partnered with colleagues in the Department of Disabilities in Maryland. And it's been a fantastic experience. I want to give a call out specifically to Elizabeth Hall, who's the Director of Interagency Affairs at the Maryland Department of Disabilities, who I work with often. And I mean, there's no one else like Elizabeth. Maryland is very lucky. This is not the case in every state, right? Maryland is truly unique and is one of the most forward thinking. So in my view, in this work, if any state is going to lead the charge, it will be Maryland. I think we all, even as an expert, have work to do, learning to do, but it's just exciting to me to do it here and to work with a state that's already right there with me and thinking about these things.
I agree 100%, Dr. Swenor, that it really is exciting to be able to tackle some of these issues in the state of Maryland because we do have such support at the top of our government and such support hands-on working with and in the disability community. One of the topics that you introduced, one of the concepts in your discussion, perhaps for some people it's a new topic and a new concept to take on, the concept of disability justice. We have a viewer question asking, where can people go to get more information? Are there any sources that you can point out as trusted sources where folks can go to learn more about the topic?
Yeah, great question. So disability justice is a framework. It's a formal framework with 10 pillars. And it was created by a group called Sins Invalid, and it's a group of people from the disability community. And gosh, I wish I could multitask and give the website to their work because it's fantastic. But that would be my suggestion, is to look on the internet for that work. That really is the foundation, and lots of people have leveraged and used it since then. It's largely actually a group of Black women and who have moved this forward, and it's built off of other social movements, and it's really the foundational approach for how the disability community is thinking about the social movement of disability inclusion at this time. It's a great question, and it's still a new, I think outside of our community, there's not enough recognition of it, but it's where we're at.
It's a lot of support for the concept of disability justice that we see in our Q&A and in the chat. We see one of the questions starts off by just saying that they're so grateful that you brought up the topic of disability justice. And then our viewer asks, I volunteer with an organization called Wheels Up that is trying to get a wheelchair spot on commercial airplanes for travelers who cannot transfer out of their custom wheelchairs. Are you aware of this inequity? Yes.
This conversation around travel for wheelchair users is not new, I'm afraid. And I think in my mind, it elevates a lot of important conversation, right? It's a conversation around lack of accessibility, lack of design for including people with disabilities. But I think also importantly, it pushes forward this idea that a lot of people don't really think about when at first pass, but that people with disabilities do all the same things that all the rest, of the world do. We want to travel, we want to go to conferences, we go on job interviews, right? So we should have an equitable opportunity to do all those things. again, a shout out to Maryland. I think what I love so much in my conversations with the Department of Disabilities and with the plan that they put forward is they recognize this. So there's a lot of the work is thinking about green space and leisure activities. It's not just about the things you have to do. It's about the things you want to do. It's really about thriving, right? And so I think this is a critical question for that concept of thriving with a disability. And that's, I love this question because it's all about getting there, right? It's not just the essentials. We've got to move the needle to a place of thriving. And this is an important one to tackle. So yeah, thank you for raising this. This is something we've got to address.
Thank you for helping us understand that better as we all are traveling throughout the holiday season and making our plans to try to reconnect with family in ways that we can that are safe. It's important for us to keep that at the top of our mind, that for some people, those challenges are even greater. So thank you for helping us understand that. If we have time for one more question, Dr. Swenor, this is a really good one that I'd love to know more about personally too. The question is, what was your path to the intersection of health and data? What opened the field up to you and what's been helpful along the way?
Another great question. Yeah, I'm trying to boil that down in a quick way to respond. I guess I've always been a person who has been interested in math. And so I think I just had a propensity to data and math, regardless of my journey with disability. I have always been a embarrassingly big thinker, as I say to my students. And so when I think about data and math behind the data, I've always thought there has to be more to this. It's not just about data for data's sake. It has to have some value and importance and impact. And so, this combination is one of what I'm interested in, what I'm passionate about, what my lived experiences are. My life is basically full of hypotheses to test, challenges and barriers to break down. And, life has shown me different ways to make change. I guess I would say that my research is my act of advocacy. And it's just the thing that I know how to do. Some people are good at other things. I'm not good at a lot of things. This is the only thing I know how to do. So I guess the combination of data and health just comes from my interest. And I'm just trying to use this tool to make change.
That's wonderful. And what a wonderful note for us to end on, because everybody that's on the line, each one of us has a way that we can make change as well. Thank you, Dr. Swenor, for a wonderful presentation that's really informed us and provoked a lot of thoughts on how we can all be better advocates for the disability community. I want to thank you for your time today, and thank you for your work at the Disability Health Research Center here at Johns Hopkins University. It's wonderful to see one of our institutions thriving and leading the way, not only in the state of Maryland, but nationwide on an important topic like this. I want to thank the entire team at Hopkins at Home, Will and Annie and everybody that's helped us with technology. They've even been kind enough to drop into the chat the website that you mentioned on disability justice. So anyone that wants to follow up on that can grab that link from the chat. Again, this conversation has been recorded so that we can continue to view it and think about it and learn and research all those different ways that we can all be better advocates for the disability community. I am Delegate Shanika Henson, representative here at the Maryland House of Delegates, saying that we're very thankful for this and we want each of you to continue to reflect on what we've learned today and empower yourself to be great advocates. Thanks, everybody. We're signing off.